Okay, so what we in Nova Scotia were trying to do is to discuss the development and the significance of the snappily titled Regulated Health Professions Network Act. And you can see now I wanted slides for this. Now, the purpose of the Act is to facilitate interprofessional collaboration, which of course has been the focus for a lot of discussion in healthcare for quite a while now. The specific problem that the legislation addresses is that collaborative care is often quite constrained by the existence of legal barriers, which often exacerbates the occupational turf wars. So you can tell health professionals, you guys should work nicely, you should play nicely together. But of course, if there are structural barriers which preclude that, then really why bother? Now, this kind of legislation is actually occurring across Canada. What's happening in Nova Scotia is nothing new. However, what we maintain is the kind of legislation occurring in Nova Scotia is quite different. We're doing something kind of interesting, we think. So in Ontario, you have what's called the umbrella model of health profession regulation. And this is a model that was developed from the 1980s that was quite novel, that was something that a lot of other countries copied. Of course, this incidentally quite annoys Quebec because they were doing this well before Ontario did that, which is neither here nor there. The Ontario model, however, is very distinct in that it's very top-down. Everything is set at the higher echelons. It's quite uniform across the regulated professions. You can see that my legal colleague had a hand in writing these slides, so unless you're a lawyer, this means nothing to you. Essentially means that there is a duty to collaborate. There's no choice or voice by those professions who are subject to this legislation. And as there is required collaboration, here's some more legal speak, but what this means is that there are sanctions involved for not collaborating, for not playing nicely. And essentially in Ontario, what the minister does have the legal right to do is to put a profession into receiver or into trusteeship, right, which is a fairly strong club. Nova Scotia, of course, being Nova Scotia, tried to do things quite in a distinct way. And in Nova Scotia, it's basically a network kind of government. It's a bottom-up process rather than top-down. It's user-driven. There are, in fact, no sanctions involved. And the process here itself is quite collaborative. The regulatory bodies have a say in how they want to use the regulation, if they want to use it, whether they want to use it together or in groups of 2 or 3 or whatnot. The theoretic framework, for those of you who are interested in such things, is called soft law or soft governance. And the principle here behind this kind of legislation is that sometimes you can actually do more, you can achieve more by pushing less. And those of you who are raising kids, I think, know exactly what I mean. And of course, the problem here, the question is, will it work? Now, Robin Tamblyn said something very interesting this morning, and I'm very glad that she's here so that you know I'm not making this up. But she said, in fact, that we have a very, very well-trained labor force in the health services. And we have to start thinking about operationalizing the principle of more empowerment for the frontline workforce. We really have to think through a new paradigm for getting the job done. And this is exactly what Nova Scotia is trying to do. There are specific advantages, and again, they're quite detailed. I won't go through these in any detail, but like I said, it's user-driven, it's participant-driven. People do it because they want to do it, not because they're told to do it. In a number of ways, there's a great deal of flexibility, and it also serves as a model to incorporate and to encourage collaborative behavior above and beyond simple professional regulation. The Ontario model contains an interesting paradox if you think about it. It looks at the self-regulating professions, but what you end up is a model of regulated self-regulation, and you have a model of collaboration, but yet it's coercive collaboration. And again, the question here is whether collaboration in fact works better when it is not imposed, whether it comes from the desire to work together rather than the threat of sanction. So just a few words on FRAN itself and the process of putting this project together. I should mention that the contribution was written by my colleague Bill Leahy, although he and I have done other work in this area, have a quite detailed political piece on it. But one thing that FRAN has allowed us to do is to really work from a multidisciplinary focus. And with respect, I think those in the health professions tend to use the word multidisciplinary when they talk about doctors talking to nurses, talking to pharmacists. And there's a lot of capacity in non-specific health service professions, so you can get lawyers and social scientists and economists and a whole panoply of people who can address ideas or problems that actually fall in between the disciplines. And the FRAN Nova Scotia experience has been like that for us. And on that note, I think that's a good segue to turning things over to you, Kiko. Thank you.